Welcome back to the channel, everyone. Today we are diving deep into something pretty major. It's at the intersection of health research and government policy. It's the impact of the Trump administration's drastic cuts to LGBTQ plus health research funding.
Yeah.
You sent over some really eye-opening articles, so we are going to unpack exactly what they say.
Awesome. Yeah, these sources, they detail some really big changes, most notably the cancellation of a whole bunch of NIH research grants that were focused on LGBTQ plus health and DEI initiatives. So DEI in this context often refers to efforts to make sure that, diverse populations are included in research and that health equity is being addressed. But, beyond just NIH, there have also been broader changes within HHS, the Department of Health and Human Services. So it's complicated and, potentially has some far-reaching consequences for LGBTQ plus people and for scientific understanding.
Absolutely. So our mission today in this deep dive is to try to understand the scope of these actions, our consequences they could have, and also what these moves might suggest about future government policies towards the LGBTQ plus community and really thinking about, the wider social impact. Now you were looking for a clear understanding of all of this without being completely overwhelmed.
Right.
So we are going to focus on the core insights and those kind of really interesting details that illuminate the bigger picture here. Okay, let's unpack this by first looking at these NIH grant cancellations. These articles really highlight some really specific, impactful examples.
Yeah, one of the most striking examples is that of Dr. Brittany Charlton at the Harvard T.H. Chan School of Public Health. All of her NIH grants were terminated.
Wow.
This included a 5-year study that was already in its 4th year, examining obstetrical outcomes for lesbian, gay, and bisexual women. That's a lot of ongoing research. That was just stopped.
Right. And it wasn't just that one either. Her research on improving family formation experiences for lesbian, gay, and bisexual individuals was also shut down. And, this kind of research is so important for understanding the challenges and successes of, diverse family structures. But probably the most concerning of all of these was the cancellation of a study that was specifically investigating the impact of discriminatory laws, like the so-called Don't Say Gay bills, on LGBTQ plus teens' mental health.
Right.
This study had millions of dollars in funding remaining and 4.5 years left. So, what kind of knowledge are we now missing out on? Because this work has been stopped.
That's the question, right? Like what's fascinating here is that the NIH, their stated rationale for these cancellations is that they are saying that research based on gender identity is often unscientific and it doesn't enhance the health of that many Americans. That's their perspective. And that really stands in contrast to the researchers' understanding of their own work, especially when you think about, the really rigorous peer review process that NIH grants typically go through. So why the sudden shift in what's considered scientific?
It is a pretty dramatic shift. And even just the sheer scale of these cancellations is pretty staggering. The sources indicate that more than 270 LGBTQ plus focused grants, totaling over $125 million in unspent funds, have been eliminated. And the actual number is probably even higher. That's a huge disinvestment in this whole area of research.
Yeah. It really is. And the cancellation letters themselves often lack, really specific justification. They kind of vaguely state that the research no longer aligns with the administration's priorities, but some letters allude to executive orders against transgender identity recognition and DEI initiatives. So it really suggests that there's some clear ideological direction behind these decisions.
And this is where it gets really interesting. Some grants focused on gay populations were also canceled because they were perceived to have DEI components. Even HIV and STI prevention research that included transgender people as a risk group wasn't immune to this. So it seems like a really broad and maybe indiscriminate approach was taken here.
Yeah, exactly. And we see this with the cancellation of Brian Mustanski's grants at Northwestern Medicine. He had 2 major grants terminated, including a long-running study on HIV acquisition in young gay men. This study has almost 2 decades of data and a recent really positive NIH review. And the termination letter for that specifically cited DEI. He also lost funding for a grant that was a part of it, ending the HIV epidemic initiative. How can you cut research that is aimed at understanding and preventing HIV, which is a major public health concern?
And Julia Marcus at Harvard Medical School had a similar experience. She lost all of her NIH grant funding for 3 HIV and STI prevention studies. It really paints a picture of some huge disruption, some really established research that, by all accounts, was super important.
Yeah, and the researchers that were interviewed really expressed concern about the lack of transparency in this cancellation process. They're really questioning
Yeah.
who exactly is making these decisions and on what basis, beyond these general statements about administrative priorities. And this lack of clarity creates this chilling effect within the research community because it's really hard to understand what kind of research is going to be supported going forward.
It's almost paradoxical when you consider that. Even Leo Sapir, who is a right-wing critic of some of NIH's approaches to gender identity research, he even criticized the administration's approach here, calling it this search term-based cancellation, and saying that it was just way too broad. And that really underscores the disruption. It suggests that it goes way beyond specific concerns about research methodology.
Yeah, it does. And the response to these cancellations has been huge. The American Public Health Association and other organizations have actually filed a lawsuit against NIH over this. What's also really revealing is this detail about metadata on at least one cancellation notice, which suggests that it was actually offered by an attorney from the Department of Government Efficiency, which is known as DOGE, rather than HHS or NIH. So that raises further questions about the decision-making process here and how much political influence might be involved.
That detail about the DOGE attorney is really surprising, and it points to a potentially unusual level of intervention. And then we have the revelation about internal NIH guidance, using this boilerplate language, to terminate grants related to DEI, gender identity, vaccine hesitancy, climate change, or countries of concern. This really points to a systematic and broad approach to these cancellations.
It does, and it's important to note here, as the sources point out, that very few of the grants that were canceled pertain to gender transition treatments. For minors, which is a huge point of public and political discussion, this really suggests that these cancellations are targeting a much wider scope of LGBTQ plus health research.
So let's shift our focus a little bit and talk about the impact that this has on the field of LGBTQ plus health research itself. The articles are really directly describe these cancellations as basically dismantling the entire field, which one source points out has been built up over the past 25 years. We are talking about a generation of scientific inquiry that's potentially being undermined here. What are the immediate consequences for the researchers themselves?
Yeah, the immediate consequences are really significant. Researchers are facing the very real possibility of unemployment, and the job market in this area of academic research is really bleak because of this funding reduction. The sources also raise some serious concerns about the erasure of transgender people from the national research agenda. I mean, if studies are not being funded, the specific health needs and experiences
this community are not going to be understood or addressed. And that can really have tangible negative impacts on health outcomes and the potential consequences for health disparities within the LGBTQ plus community are really worrying. The loss of research could make existing inequalities related to HIV mental health, substance use, and chronic diseases even worse. There was even mention of studies that document a rise in mental health distress among LGBTQ plus youth following anti-LGBTQ plus legislation. But now the research is being stopped.
Right, like that 2021 analysis showing that there was an increase in crisis text line text from LGBTQ plus youth after anti-LGBTQ plus legislation was proposed. And then you've got the 2023 Yale study linking discriminatory policies to higher depression symptoms. Black non-Latinx, LGBTQ plus youth. These really highlight the importance of this kind of research for understanding the lived experiences and mental health needs of LGBTQ plus individuals. So losing the ability to do this kind of work has really profound implications for our ability to actually respond to these challenges.
It could even lead to the closure of vital centers, like the LGBTQ Health Center of Excellence at Harvard, which Dr. Charlton mentioned. And while private funding is important, as Shell's pointed out, it can't replace the scale and scope of NIH funding.
Exactly, the breadth of research questions that can be addressed and the long-term commitment that NIH funding allows is really hard for private sources to replicate, across the board. So it creates a real vulnerability for sustained progress in this field.
So let's think about the broader changes happening at HHS, because these articles point to a pretty significant restructuring that goes beyond just these NIH grant cancellations. What were some of the key changes there?
Yeah, so HHS underwent what they're calling a dramatic restructuring, shrinking from 82,000 to 62,000 employees. That is a really substantial reduction in workforce through layoffs, retirements, and resignations. On top of that, the department consolidated 28 divisions into just 15.
And this wasn't just administrative reshuffling, was it?
No, not at all. These layoffs impacted some really important public health functions. We're talking staff at the FDA, who are overseeing food safety, the CDC division responsible for things like cruise ship cleanliness, and even staff who manage FOIA requests. The Low-Income Home Energy Assistance Program also saw staff reductions, as did regional administrators for the Administration for Community Living, which provides support for older adults and people with disabilities. So the impact seems pretty widespread across various essential services. Yeah. And it wasn't just personnel changes either. High-profile leaders within really key health agencies were also affected here. Jean Marazzo, who is the head of NIAID, and Jonathan Merman, who is the director of the CDC's National Center for HIV, Viral Hepatitis, STD, and TB Prevention, were both reportedly put on administrative leave. And these are really crucial leadership roles in addressing huge public health challenges.
And it wasn't just personnel changes either. The cancellation of $11.4 billion in COVID-era grants also had a direct impact on vital community services, like a mental health call line in Wisconsin, which was forced to shut down, with the reasoning that the COVID-19 pandemic is over, which seems to kind of disregard the ongoing need for these kinds of support systems.
Right. What's really troubling here is that infectious diseases programs, especially HIV research and prevention efforts, appear to have been really specifically targeted in these layoffs and grant terminations. This includes staff who support the Presidential Advisory Council on HIV and AIDS and those involved in HIV and AIDS communication. So this raises some real concerns about the future direction of our national response to the HIV epidemic.
They even eliminated a CDC lab that conducted specialized testing for drug-resistant STIs, which, as one source points out, are increasingly prevalent in gay men. From a public health standpoint, this seems like a really bad move.
It does, yeah. The concern is that having less communication staff will really hinder the dissemination of critical information about new HIV treatments, like PrEP. And this could disproportionately impact, certain groups like transgender people, Black men, Latino men, who already may face systemic barriers to getting this medication. So this could potentially lead to an increase in HIV transmission rates.
And then the significant reduction in staff at the Administration for Community Living is also really concerning. Laying off regional administrators and budget grant staff could really mess up the distribution of congressionally approved funds.
And, these essential services
that allow older adults and people with disabilities to live independently in their own homes. I mean, what are the consequences for these folks in the long term?
Well, this could mean big disruptions in the support systems that these people rely on, and potentially increase their reliance on more expensive institutional care, which could really impact their quality of life. It raises some serious questions about, whose care is being prioritized here.
Okay, so looking ahead, what do these sources suggest about future government policies concerning the LGBTQ plus community, and what kind of broader social impact might we see? It seems like there's a big shift in direction happening.
The sources do seem to indicate a move away from prioritizing research that's related to DEI and what this administration calls gender ideology. There's this big concern among researchers and advocates that LGBTQ plus people might even be excluded from big federal surveys that collect data on health crime victimization and even the census.
That would be a huge step backwards, wouldn't it? The inclusion of LGBTQ plus identity in these surveys has been a hard-fought victory, and it's provided really essential data for understanding this community's demographics, needs, and disparities. Losing that data would have so many negative consequences for policy development, legal protections, and public awareness.
Yeah, this data informs everything from how resources are allocated for health programs to the arguments that are used in legal cases, fighting for LGBTQ plus rights. So if that data is gone, it creates this huge information void, which makes it so much harder to advocate for the needs of this community and to track progress. While the Biden administration had emphasized, addressing the needs of sexual and gender minorities, and that led to an increase in NIH research funding. This current administration's actions really are a reversal of that.
The new NIH director, while stating that the agency remains committed to supporting research aimed at improving the health and well-being of every American, he really emphasized a focus on chronic conditions affecting all Americans, including LGBTQ plus individuals, but without even mentioning gender identity or HIV, despite its disproportionate impact on the LGBTQ plus community.
Yeah, James, you're right.
Pretty big omission.
It suggests this move towards a more generalized approach. That may fail to address the really specific and unique health challenges and disparities that LGBTQ plus people face. There's also this big worry about losing a whole generation of academics who are dedicated to LGBTQ plus health research because of job losses. and uncertainty about the future of the field.
Yeah.
Younger researchers might be really hesitant to enter or even stay in a field where there's limited funding and a possibly hostile political climate.
Some researchers
Yeah.
are even drawing parallels to the AIDS crisis in the 1980s, where there was
Yep.
a real lack of dedicated funding and huge government inaction in those early years, which is a pretty sobering comparison, and it highlights the potential long-term consequences of ignoring research into the health of marginalized communities.
It's a really stark reminder of how critical it is to have dedicated research funding and government support for addressing public health crises and, meeting the needs of vulnerable populations. But, as one of the sources also pointed out, the LGBTQ plus community has this long history of resilience and a proven track record of fighting for their rights and their well-being. So that historical context provides some hope, and it really underscores the importance of continued advocacy.
So as you can see, this deep dive into this material reveals this really complex and rapidly changing situation. These big cuts in research funding and the broader changes at HHS have really profound implications for the health and well-being of the LGBTQ plus community and for scientific understanding of their specific needs.
Yeah, the sources really show that this research field is facing huge disruption and uncertainty with potential long-term consequences for addressing health disparities and informing future policy. It really seems like the debate over what is scientific research and what is the role of DEI in health initiatives is really a central driver of these changes.
The situation raises some really important questions for you. As someone who values knowledge and understanding, what are the broader societal costs when we deprioritize research on the health of specific populations? How might these changes ultimately impact the health of LGBTQ plus individuals
and the healthcare system as a whole in the years to come? And what role can private funding
and continued advocacy play in maybe mitigating some of these negative effects?
These are really big questions. As we navigate this changing landscape, it's really important to understand the potential long-term ramifications here. And the possibility of widening health inequalities.
It's definitely a
Yeah.
developing story.
Yeah.
And we really encourage you to think critically
Mm.
about this information that's been presented in these sources and to keep looking for diverse perspectives on this issue. And finally, if you found this deep dive valuable and it helped you gain a clear understanding of these complex issues, don't forget to subscribe to our channel for more in-depth explorations of the topics that you care about.